Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. Thank you all for joining today's webinar hosted by the Sikh Research Institute. My name is Birinder Kaur. I would like to begin just by giving some brief introductory information. If you lose your internet connection or have to restart your computer, you can rejoin the session using the URL in your registration email. If you're wondering how to interact, I will give you two ways to do so. You can either type your questions here in the Q&A panel, or you may turn on your mic, which is pointed to using the left arrow, and you can verbally ask your question. As a reminder, today's webinar is being recorded and it will be available on SikhRI's YouTube channel within the next few days. If for any reason, again, if you lose your internet connection and have to restart your computer during the session, you can rejoin by clicking the URL that is included in your original registration. Before I introduce you to the presenter, here's a bit of background information on the Institute. The Sikh Research Institute's mission is to provide educational resources to Sikhs to lead a Guru-inspired life. As a global nonprofit organization, we produce original online courses, research papers, videos, podcasts, events, and books to create the largest go-to source of Sikh knowledge online. Now I have the pleasure of introducing you to our presentation and our presenters. As we continue to navigate social distancing together, we wanted to be able to engage the Sangat in a conversation with frontline workers. We hope to create an intimate Sangat experience during this hour or so that we are together. We will begin with a 20-minute discussion, followed by a Q&A session. So please do drop your questions in the chat box. Please make sure to put your name and your city when asking your questions. So first we have Dr. Birinder Singh. He is a family physician working in Vancouver, British Columbia. His work is informed by his relationship with Sikhi, and he has been a consumer and volunteer of SikhRI for over a decade now, including attending Sidak in 2016. During the Covid-19 pandemic, he has been actively involved in frontline care and strategic planning for primary care response in Vancouver and Burnaby. Dr. Manjot Kaur is an emergency medicine physician in the last months of her residency at Louisiana State University. During the Covid-19 pandemic, she has been a frontline responder in New Orleans. Manjot attended Sidak in the early 2000s during her formative years. Her Gurmat education via family, Sangat, and programs such as Sidak has inspired activism and recognition of the human condition. And lastly, we have Dr. Sharandeep Singh. He is an activist, educator, and philanthropist residing in Scotland, UK. He's working as an anesthesiology and ICU resident in Scotland. Since attending Sidak in 2011, he has been inspired by the values of Ek Onkar, leading innovations in Gurmat education among Scottish Sikh youth. In response to the coronavirus pandemic, he co-founded the Sikh Food Bank in March 2020 to serve those in need. Amazing. Hello. I would like to invite all of the panelists to unmute their mics so we can get our conversation started. Hello, welcome. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.
Vaisakhi Ji Ka Khalsa, Vaisakhi Ji Ki Fateh.
Amazing, awesome. So I think I'd like to begin this conversation, perhaps starting by going around, just so the audience can get to know everyone a little bit better, taking a few minutes to share your experience with Sidak, the year you attended, perhaps, the lessons that you took away, and perhaps the lessons that you still carry with you today. Manjot, maybe we can start with you.
For Sidak, yes.
Yeah.
Vaheguru Ji Ka Khalsa, Vaheguru Ji Ka Fateh, everyone. I attended Sidak in my formative years, probably early high school. Mm-hmm. And I think that some of the best lessons I took away from that are that we have all the agency to interpret Gurbani for ourselves, and we don't need to depend on a middleman. All the tools are out there. And even if we can't memorize the tuk or know all the Banis out there, I know I don't, anytime in the world around us, we feel our common sense intuition or our gut align with our thought process, and it's love-oriented, there's a token Gurbani or a Sakhi in Sikh history that will probably send that same message. So really just about opening our hearts and being more aware of our own intuitions. I think that's what I got out of that. And then I left my last year definitely more inspired to like stay rooted and not forget why we go into the things we go into the real world. Activism and social justice became even more a journey of that same love that's driven by Gurbani's message.
Definitely. Thank you for sharing. Birinder?
So, I've been part of SikhRI peripherally since close to its inception. Family was involved in when SikhRI was introduced in Canada in the early 2000s. Never had a chance to do Sidak until after I completed my medical education. So I finished my residency in family medicine in 2016 and in July, and then I spent that summer to take an opportunity, finally attempt Sidak, and I ended up attending the 101 track, which I believe is still the same track that's offered, one of the tracks that's still offered now, which is it's an introduction to kind of Sikh history and theology, but it's so much more than that. I mean, with Sidak, it really independent of whatever track you do. The experience transcends the track, and there's a lot of shared learning experiences and a lot of Sangat activity that you do to connect with each other. And so the experience itself was amazing. And technically, there was a lot of time spent on Santia and learning Vaisakhi and really doing a deep dive into Vaisakhi. That experience still stays with me today, whether driving if I can't wake up in the morning before a shift to do it, or just always have it listening and reminiscing and recollecting on the teaching specifically in Vaisakhi. And that informs my life today.
Definitely, yeah. Thank you for sharing. Sharandeep, sorry.
Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. It's a pleasure to join you guys here on today's webinar, a really kind of relevant topic at the moment. And thank you for everyone who's tuning in around the world. So I attended Sidak in 2011. So it seems quite scary to think it's nearly 10 years ago now that I attended. I was in medical school at the time when I was invited to attend, and I think probably it's been one of the most life-defining experiences that I've had for 2 weeks of instruction and education by the Sikh Research Institute has actually inspired me to go out back into my communities here in Scotland to come up with new and innovative ways to share the message of Sikhi, the inspirational message of the Guru Granth Sahib, and really make it an extremely relevant message, and also to implement practical solutions. That for me was what was the kind of eye-opening learning that I gained from Sidak, the Sikhi 201 track, which I attended, which was looking and examining the kind of manifesto that was in the Guru Granth Sahib, and then looking at the Guru's lives and seeing how all the 10 of the Gurus created practical real life institutions to actually achieve that in reality for society at large. And so that for me, whether through my personal career or through my community work, through the seva that I do, that's what I've tried to achieve, is always being connected to the values of Guru Granth Sahib, and then coming up with projects and programs and solutions in society that will actually help us to deliver those.
Yes, definitely. Yeah, I think you, all three of you kind of touched upon it, but perhaps we could delve a little deeper again, just a round table, on how these fundamental understandings of Sikhi shape both why you decided to pursue this career path, as you all are in the medical field right now, and how you engage these understandings in your work. Perhaps again, Manjot, if you don't mind, we could start with you.
Yeah, I'll keep it pretty simple and short. I'm actually looking at it at my wall right now. Ever since I've been in high school, one of my cousins brought back this painting of calligraphy of a Tuka and Gurbani that have become my motto for my path or journey, especially professionally. Joto prem khelan ka chao, sir tar tali gali mariao, itmarak bar tari ja, sir dija karna kija. And as you know, a millennial brown kid growing up in the States, not really fitting in, I just identify with that, saying, if you want to play this game of love, come to me with your head in your palm. And when you set foot on this path, there's no looking back. That's exactly how I've gone. There's no looking back. I'm in it, and I'm in it for real. And what that means, to another person, how they define their Sikhi, I think for every Sikh, that definition is extremely personal. Apart from the Rahat Maryada, there are things that even those who don't follow the Rahat can personally identify with and are extremely inspired by. And I think that the writings in Gurbani reflect that as well, with the folks that the Guru decided to include in Guru Granth Sahib, that there's so many people who are inspired by the Sikh way of life and Sikh philosophy. And, if that can keep them committed to the journey that is love-oriented and therefore Guru-oriented, that's everything. So that was my biggest takeaway professionally. That has really helped me stay resilient and strong, because the microaggressions and the difficulties, they don't end. And working right now during the COVID era has definitely highlighted that as well. But Gurbani doesn't serve as a patch on a leak. Rather, it helps me redirect my energy so that it continues to flow while the leak, wherever that hole or holes may be, can heal on their own. And I think if we take that lens, for me at least, when I take that lens away from, here's my solution, I'm going to use bot or whatever to patch this leak and somehow it's going to stop, and shift my lens to, no, Gurbani is going to be how I redirect the flow of my energy so that I can heal however I need to, It really helps me stay grounded and see more of what my purpose is and where the Guru is in my life for me,
Yeah, that's amazing.
What about you guys?
Yeah, no, that's I think no worries. This personal relationship is very important, I think. Sharandeep, perhaps?
Yeah, so I suppose it's often kind of joked about the stereotypical career paths of brown and Asian kids, accountants or doctors and things like that. And sometimes just kind of, made as a little joke. But I think it does really connect back to, especially at times that we're living through now, we are seeing, how the ways in which we can serve society and the public at large. And there's not a lot of careers and not a lot of jobs that let you earn your keep and also do a type of seva. There's not a lot of them, but I feel really privileged to be in a career that does allow me to serve those who are in need, underprivileged communities, or to be able to utilize my professional skills in an era where they are needed. And I do feel that was partly inspired by, the Sikh values of seva that kind of directed me towards a career of public service. And I think that's kind of very much connected, that I wanted to be able to, through my personal life and through my professional life, whether that's volunteering or working, kind of have that flavor, have that element of Sikhi and seva throughout.
Awesome. Amazing. Yes, definitely. Thank you for sharing. And thank you for coming back, Birinder. I hope everything is good now. I'll just reframe the question for you. We've just been speaking about kind of the fundamental values that we spoke about, that you guys spoke about at the beginning, that you perhaps gained a little from Sidak, and how those shape why you decided to pursue your career path and how you engage with your work currently.
Sure. No, that's great. Is this coming through clearer now?
Beautiful. Yeah.
Okay.
We can also do great.
Sorry, we had a bit of sound issues before. So yeah, no, it's very similar to what Manjot Kaur and Sharandeep Singh have already shared. But for me, medicine was the norm. I come from a family where we have had the privilege of having some physicians in our family before, and so it was the normal. But it wasn't. You can go through all your training and still come out the other side trying to find where you fit in. Every field that we go into, there's lots of variability and variety available to us. So a lot of my focusing on what I was going to do came after. I was, we worked around lots of different settings, from acute care to outpatient primary care, and different models of care. And now I've landed in this setting where I'm working in a community health center where we deal with a lot of patients with addictions, mental health issues, transgender issues, refugees, and that is where I really found inspiration in my work, and that's where I really saw a lot of my Sikhi influence being able to be applied on a daily basis, rather than just doing the grind as some of us have to do in our work. And so every day is a unique experience, and a lot of people who face a lot of barriers in care. We had already been adapting our work to being able to provide care to them, and so we were well set up to handle the stresses of today's world.
Definitely. Thank you for sharing, everyone. Something that I'm particularly interested in are all of our literal physical locations and how those have each been impacted by COVID-19. Perhaps Sharandeep, you could start first this time.
Yeah, so I come from a little old country called Scotland, which is kind of associated with the United Kingdom and Great Britain. I was born and brought up here. It's a country of about 5.5 million. So on a population level, fairly small, but through historical impact, it's well known worldwide. Scots are very famous. Similar to the Sikhs, I suppose. We're a small population, but are globally renowned. So through specific lens, looking at what's going on just now in terms of the coronavirus pandemic, it feels like we've been living in this kind of era forever, really, really long time. It's been the topic of conversation, headline news for so long. But relatively, it's only really been a major issue in this country for about maybe 2.5 months. We all know the coronavirus pandemic started in China November, December last year, and kind of slowly and progressively worked its way around the world. From a professional point of view and a Scottish angle, we were fairly lucky in one sense that we were able to observe how the pandemic, how the virus was playing out in other countries. It only really became very real for us, I would say, on a general population level through the conversations I was having at work and with friends and family, when we started to see the pictures coming out of Italy, who sadly were, extremely, extremely hard hit. And were slightly overwhelmed by the numbers. Their health systems became very overwhelmed. And that was a real wake-up moment for us. And our health managers, our politicians really pulled their socks up at that point and thought, there's something major that we have to do. And that's when I think the narrative changed from just being, a little bit like the flu or, like a common cold, where suddenly people were people were using words like battle ready and we've got to kind of be, into a war footing. That's when we realized that it was going to be as dramatic as that. So what happened following on from that within the NHS of Scotland, which is like a centralised health system. It's public healthcare, free at the point of use. It's nationalised, and that I think was actually quite a useful system to deal with a virus like this, because once the decision came from the top, everyone in that system very quickly mobilized, and there wasn't little pockets of, one system, having different priorities compared to another one. This was a population pandemic, and the health service was organizing on a population level. So my normal day-to-day work as an anesthesiologist and intensive care resident, on a Monday to Friday week, I would be doing like theatre lists, anaesthetising patients for different operations. And then I would also be doing like ward rounds on the intensive care, assessing maybe patients who have had a car accident or serious infections. When it came to redesigning the system for the coronavirus crisis, what we had to do was go back to beginning. We had to just rip out the playbook. We cancelled all elective surgery. And we have about 12 theatres in my hospital, so we're doing hundreds of operations a week. Everything got completely cancelled. All of the staff, all of the theatre nurses, all of the surgeons, all of the anaesthetists were completely redeployed. So we were really focused on how we were going to be dealing with the coronavirus crisis. We then also tripled our intensive care beds to be able to prepare for the patients who were going to be having the need for ventilators and things like that. As the pandemic developed, we had a quick lockdown, which is where the whole social distancing, all those kind of rules came into place. And luckily, we are starting to see a plateau in the number of cases. And we think that the public health measures that have been introduced have worked and are working, and they're allowing our health service to cope with those numbers. From a personal point of view, and reflecting on how SikhRI's helped me through this, as medical professionals, we were kind of in the know early on. We were getting all the intelligence about what was going on, and we were, mentally preparing ourselves perhaps a lot earlier than the general population. So we all have had a significant kind of mental burden and emotional toll. We've all got family members. I remember sitting in the tea room of my department, and all of us, we were talking about which of our elderly family members were the most at risk. And it was a really sobering conversation to have, because I was talking about my dad who's got certain health problems, and then one of my other colleagues was talking about their parents who've got certain health problems. And it was then we realized, actually, we're not immune from this. It's not a doctors versus patients thing. It's like we're all in this together, and then all of us are kind of at risk. So it was kind of an emotional time slightly, but then our professional duty kicked in, and for me personally, my time to reflect on Gurbani and Kirtan was a moment for me to be able to get solace and inspiration to keep doing and have the Chardi Kala spirit through these difficult times.
Yeah, thank you so much for sharing, Sharandeep. Perhaps speaking a little more about how healthcare workers can also be patients. Perhaps Manjot, as someone who has contracted coronavirus, perhaps you could speak a little about that experience.
Yeah, definitely. Just to briefly about New Orleans. New Orleans is a predominantly Black city, and this is also one of the cities that was one of the latest to desegregate. So socially and politically and economically, there have been barriers already with access to many resources, including health and healthcare. There is fear of the healthcare system. There is great disease in the community. And we have seen the asymmetrically devastating impact on our Black patients here. And the data is being processed as we speak. But we have the anecdotal evidence. We're seeing it with our eyes. And that for me personally already highlights the things that I went into medicine for, really for the justice in it. My particular interest is in social emergency medicine and advocating for those who are underserved no matter how. And March was definitely like battlefield medicine for us. We were organized to some degree, but I still remember the day I had one COVID rule out, March maybe 9th. And the next day I walk into the same 14-bed area that I'm responsible for. And all of a sudden, except for one brain bleed, everyone is COVID. And at that time, our infection control policy was only to test those who had been to China. And andro, I was like, no, like this is not okay. So we sat there. We found our ID attending, our infectious disease attending in the hospital who works with the Department of Health. And I was like, I have this list of patients right here. And until I get, because we were not legally allowed to test them at that point. Until I got her permission and went through each patient with her, those patients, it wasn't decided whether they were going to be sent home or admitted. And even if they were being admitted, I wanted to make sure their test didn't fall through the cracks. And within hours, if not a day after that, finally, the policy became more reflective of a community-acquired problem, something that's spreading in the community rather than just something that you get if you went to China. And at the same time, we were running out of supplies. You know, I remember I did a procedure and I could smell the breath of my patient through my masks. And these are masks that are supposed to protect us from getting the infection. It was my birthday, the first day I got my first exposure call. And the day I tested positive was probably the same day I got a list of all the patients I had already known I was exposed to. So it was ironic, the information, the way it was delivered on the kinds of days it was delivered. And prior to me getting tested, I was very fatigued. You know, I couldn't understand. I'd done the fatigue and burnout survey that had been distributed nationally for all resident physicians, and I think really healthcare professionals going through this. It asked about if we're sleeping less than 5 hours, if we're having nightmares, if we're having emotional outbursts, if our family can't or won't see us due to their risk of infection, if our loved ones in general are distancing themselves from us, whether we feel completely isolated, not because it's a mandatory regulation by the government, but because of the nature of our current conditions right now as healthcare professionals as frontline workers. They, you know, obviously all those answers were positive for me, you know. I started getting more and more tired though. I remember I did this crash procedure one day, a pericardiocentesis. It's when you basically stab the chest to drain blood around the heart on a patient whose heart stopped beating. This is a procedure that most people don't do in real life anymore because usually you don't need to, but our medically sick patients were really sick. And that day, I remember I was fighting to maintain like consciousness. I was just tired and I thought it was the stress. And then I got waves of feeling chills, etc. And days later, I slept maybe 16 hours after a shift, having had slept before that. I did not have a fever. They were checking our temperatures. I was less than 100.4, which here in the US, I think in medicine, we consider a fever, right? Anything above 100.4 Fahrenheit. I had all the atypical symptoms like fatigue. And then eventually within days, I have allergies all the time. My allergies got even worse. The allergy medicines weren't working. I felt like I had a sinus infection and the cough did come on. But my most severe symptom was fatigue and this crazy difficult headache. And that's when I knew I had to get tested. And the only reason I knew is because I had the privilege of having met patients who had been treated for, quote, sinus infections, even abdominal pain, which initially they thought 10% of patients have, but later research showed it was up to 50%. You know, and I remember having to fight and advocate for my patients who my superiors felt didn't warrant testing because they didn't have fever plus cough. Mere thoda fever te cough hui si. And the only reason I knew to pay attention was because I had the honor to serve for those patients and fight for them. And it's definitely the Sikhi within me that's the fight within me. I'll tell you that every time I have to fight for myself or my patient or what I think is just, I go back to something from Sikh history, something from a Dharma Geet, anything that just sustains my spirit when I feel like the world around me is trying to squeeze it. Having COVID was definitely difficult. It didn't just end like the flu in a couple days. I was alone, so I brought my tea kettle to my room. I took control over whatever I could take control over. It was one of the few times I have like slept properly. My sleep was affected, but I was so fatigued, I finally slept. A lot of us don't like to be weak, no matter in what form, physically or mentally or psychologically. But this was a time when I had to become open and honest. I knew I was alone. I knew I could take care of myself. But I also had to be honest that, yes, I'm going through a difficult time psychologically, mentally, and physically too. And I think sharing my experiences has been healing for me, but it also helps me relate to my loved ones. I know that I would call home some days and chew my family out because they were not practicing the measures that I felt were appropriate. I remember the day I begged my dad to work from home and stop driving to DC. And for some reason, it was just not clicking. And eventually it did. But when it clicked for them was maybe when I got COVID around then. But that was maybe 15 days after what I had seen. And that's why I was begging them. I remember I got on the WhatsApp group for my family and I was like, please listen. Like, please know this is real. I understand that in parts of the United States, it's a little bit harder to feel like, we should be following all this. People are itching to go back to quote life. But what is life? What is living? Is being addicted to partying on Saturday night and going out to the club and, having your little tea party or job party on Saturdays with your girlfriends really life or living? Is there another way to redirect our lens on how we live? Is eating takeout and going out to fancy 5-star restaurants really living? Is eating food out of cans and boxes that's dumped on plates and provided to you in a fancy looking building really food? Or is eating stuff that actually grew out the ground and off a tree or something and cooking it food and life? And if we're eating life, perhaps we're living. But if we're not eating life, then are we really living? It's a time to redirect our lens on really what it means. And at the same time, in our community, especially, ਮੈਨੂੰ ਪਤਾ ਅਸੀਂ ਜ਼ਿਆਦਾ ਇਹਨਾਂ ਲੁਕੀਆਂ ਟਕੀਆਂ ਗੱਲਾਂ ਬਾਰੇ ਨਹੀਂ ਗੱਲ ਕਰਦੇ, ਭਾਵੇਂ ਡਿਪਰੈਸ਼ਨ ਹੋਵੇ, mental health disease ਹੋਵੇ, ਜਿੰਨਾ ਮੈਂ ਰੋਈ ਹਾਂ ਪਿਛਲੇ ਮਹੀਨੇ ਡੇਢ ਚ, I've never cried this much. ਪਰ ਅਸੀਂ ਇਹ ਜਿਹੀਆਂ ਗੱਲਾਂ ਬਾਰੇ ਅਸੀਂ ਗੱਲ ਨਹੀਂ ਕਰਦੇ ਤੇ ਅਸੀਂ ਇਹਨਾਂ ਤੋਂ ਡਰਦੇ ਹਾਂ, ਝਿਜਕਦੇ ਹਾਂ. And sometimes I've cried because I'm mad that I'm weak. So I suffer the same problem. But this is the time, in medicine, we have something they call adjustment disorder. When a couple factors from either your financial, physical, mental life, your geographic location, or your career change, every person in the world meets the criteria for adjustment disorder. And when that kind of period happens in an individual's life, it will exacerbate underlying things that we may or may not be aware of, whether it's anxiety or depression or substance abuse or issues that we have with how we treat others, maybe a personality thing that we just never really got a chance to heal or really investigate or heal from, This is the time to open our hearts and love ourselves and love those around us and really, really be okay with the fact that we can be weak,
Some really interesting points you said there, Manjot. I actually found quite insightful, particularly about kind of, the gravity and the scale of the disaster, and particularly about what we regard as normal. And I think that's a really good point, because there's few times, ਇਤਿਹਾਸ ਦੇ ਵਿੱਚ ਕੁਝ ਸਮੇਂ ਆਉਂਦੇ ਆ ਜਦੋਂ ਇੱਕ ਵੱਡਾ ਹਾਦਸਾ ਹੁੰਦਾ ਆ ਔਰ ਇੱਕ ਵੱਡਾ ਇਵੈਂਟ ਹੁੰਦਾ ਆ ਤੇ ਉਸ ਤੋਂ ਬਾਅਦ ਜਿਹੜੇ ਚੇਂਜ ਮੇਕਰਸ ਹੁੰਦੇ ਆ ਜਿਹੜੀ ਸੋਚਦੇ ਆ ਵੀ ਸਾਨੂੰ ਹੋਰ ਕੋਈ ਤਰੀਕਾ ਲੱਭਣਾ ਪਊਗਾ ਸਮਾਜ ਬਦਲਣ ਲਈ. That is a moment in time. I think this is a moment in time. This is a moment in history where we've had such a big shock to our global system, whether that's our economic system, whether that's our social system, or whether that's our personal life. Or if you look at things like the major climate emergencies, the major economic inequalities in the world, I hope that this is a point in time where we can actually maybe start to reset some of those inequalities, some of those major challenges, because it's been such a major shock to the system. And I like to follow the news and read some of the kind of commentary, and there's some really, really interesting discussions going on by economists and academics to try and think about how can we redesign our world on a personal level and also on a kind of macro level, on a global level. So I think that's a really interesting and exciting discussion. And I think that as Sikhs, then I think we also do, those of us that have that concern should, be at the forefront. And as a Pant and a Qawm, we should maybe start, once we're over the initial kind of, the emergency response, we may need to pivot to start to look at and think about how we can redesign our world in a more, Gurmat-oriented way.
Mm-hmm. Yeah, deconstructing and challenging the norm, and then falling in love with this beautiful mat we've been given, our imagination, to reimagine without borders a society or a world around us, I think is something we owe ourselves. We should not accept people who are so unintelligent that they are willing to talk about injecting toxic substances into your bloodstream as a possible therapy seriously on a presidential level, when literally less than a week ago, there are articles in Average Joe's newspaper that every American out there who has access to or ability to read a newspaper knows poison control calls have gone up in the month of March already from poisoning from disinfectants. You already know the threat of this issue. And as a leader, we are accepting this kind of norm. I mean, this is almost like a divine joke by the universe, There's no way that this is the reflection of the intellect of the average American.
I actually remember reading there's some article that I read in one of the newspapers, and the journalist was saying that we're living through two pandemics now. One is the coronavirus pandemic, and the second is the fake news pandemic, which I really feel is a feature of our life within the last kind of 5 years or so, where suddenly the kind of disinformation and the kind of distraction, the sowing of doubt in the general population has become such a coordinated strategy by certain actors. And I think it's quite interesting that now it's crossing both our fields, where we're not having to just deal with the virus, but we're also having to deal with the disinformation about how to treat it, and we all try and practice evidence-based medicine, test and trial something before we say this is safe. And I know that often you have to, sometimes when I look through my mom's WhatsApp, ਉਹਦੇ ਵਿੱਚ ਕਿੰਨੇ ਮੈਸੇਜ ਆਏ ਹੁੰਦੇ ਆ ਵੀ ਇਸ ਤਰ੍ਹਾਂ ਦਾ ਪਾਣੀ ਪੀਵੋ ਤਾਂ ਕਰੋਨਾ ਵਾਇਰਸ ਤੁਹਾਡੇ ਲਾਗੇ ਨਹੀਂ ਆਊਗਾ, ਇਦਾਂ ਦਾ ਪਾਣੀ ਪੀਵੋ, ਨਿੰਬੂ ਵਾਲਾ ਪੀਵੋ, ਤੱਤਾ ਕਰਕੇ ਫਿਰ ਤੁਹਾਡੇ ਕਰੋਨਾ ਵਾਇਰਸ ਨਹੀਂ ਆਊਗਾ. And it's been really interesting to see how things that we regard as great innovation tools, like the communication tools that we have now, how they can become corrupted. And I remember, from Sidak, the idea of Bibek Bud, which is a line in Gurbani, and also a Gurmat term, which is actually to use your discriminatory knowledge to actually that's what we've been gifted with as human beings. We have this intellect that allows us to discriminate what's right and what's wrong, what's truth and what's a lie. And I think that's something that we all try and develop through our gurdwaras, and hopefully, and it's been actually really interesting. I feel that looking at what's going on within the Qawm, I've been quite heartened to see some of the news coming out from some of the Sikh leaders. I know oftentimes that our Sikh leadership has often failed us, but I feel that the current Untitled Chapter, Birinder Singh, really interesting commentaries he's made in response to like some of the Indian government statements, whether that be against like, you know, the fake news against Muslims. I remember they were trying to say in Indian news that it's Muslims that are spreading the coronavirus, and he actually came out, made a really strong statement and instructed the Sikh community, you know, not to fall for this fake news, to make sure that we are abiding by the values of Guru Nanak and we are not discriminating against any communities. And that for me was a really novel observation. It's not often that I've seen, you know, the Sikh leadership actually be open and proactive in making these statements. So I think that's a really interesting observation as an individual to have seen that happen.
Yeah, thank you all for sharing these insightful, your personal experiences. And perhaps to kind of bring the audience in, I would like to just remind everyone that if they have a question, they are welcome to ask it in our chat window. Just state your name and your city and your question, and any of our panelists will be happy to answer your question. And perhaps bringing Birinder back into the conversation. I know we've been talking about how this is a collective trauma, but then this is also impacting everyone on an individual basis. As healthcare workers, what is your advice for those tuning in, for your own families who love and fear for you as you are frontline workers, and for those who are joining us who may have loved ones on the front lines?
Sure. Yeah. No. It's been a good discussion so far. What I just picking up on a few points that have been mentioned. You know, you know, everything happens for a reason, and I think that we're really forced to think about our Sikhi in a way of it. Can we accept Hukum the way it is right now, and everything that's happening is Hukum? And you know, there's something poetic about the timing that this has happened, and with everything else going on in the world. And for us, all of us who identify with Sikhi, that, you know, Vaisakhi did fall in the middle of this too. And you know, what was Vaisakhi? Vaisakhi was Guru Sahib putting his faith and leadership in the Panth. And that's what Sharandeep Singh was kind of mentioning right now, that we have been fortunate that there has been a lot of leadership within the Sikh community, and I've seen that happening in multiple locations. You know, I was part of a campaign locally here called Virtual Vaisakhi, which was a group of Gurdwara and our local Sikh organizations who came together for a central response, whether it was giving people food who needed it, or supplies who needed it, or just connecting with counseling services or any other care needs. So there was, you know, a group of probably 30 to 40 people representing different organizations locally, and we just all got together. And you know, Sidak, as part of leadership training, was pushing us to adapt to an environment we're not used to, and challenge ourselves and our own capacity. And I think on a community level, we've been doing that. And just touching on a point of what Sharandeep Singh said too about, you know, we are living in an age of misinformation. We need to fine tune that a bit too. There are people who have spread misinformation for personal gain, or whether that's economic or political or strategic. They're doing it out of selfish reasons. There are other people who are doing it out of fear. They're doing it because they don't know what's worked, and we're all operating on a basis where we would love to have evidence-based medicine, evidence-informed treatments to approach this, but that evidence doesn't exist. And you know, when we get back to it, you know, we have a chance. Perhaps Manjot Kaur can share her experience. You know, we've a lot of us sort of have heard about hydroxychloroquine and other experimental treatments in the community, and in our own circles, and in the media, and in the medical circles too. And drugs do have a role to play, but everything we give you is a double-edged sword. Everything, any treatment has potential side effects, and we have to think about the downstream effects. Now, coming back to your question about sorry, if you could just repeat it. I just wanted to get those points, but it was really about how we can.
Yeah, definitely. I can. Thank you for following up on all of the important conversations that are being had. My question was kind of centering around trauma, kind of the collective nature of COVID, but also the individual nature, because it is affecting different communities in different capacities. But also thinking about this community that the three of you belong to, so healthcare workers. What is your advice for people that love you and fear for you as you go to work every day? For those joining us who may have loved ones on the front lines, what is your advice to them? How can they support healthcare workers and frontline workers?
Thank you. Yeah, so I think that we're in a unique space where, there's a well-defined disorder within medical literature and experience about post-traumatic stress disorder, but a lot of us are facing pre or peri-stress disorder at this point, where we're anticipating more stress, we're living the stress right now, and we can already see the downstream effects of it. So part of that is having ongoing preparation for ourselves on an individual and community level, and how we can prepare for the collective trauma that is happening for us, and how we can do that on an individual basis and for our own families. And a lot of that, we are fortunate that we can use our Punjabiness or our Sikhiness to inform our responses to that, which is where we do draw on our communal nature and our connection with each other. And what is it, Kunkar, right? Like, we are all connected, we are all one. And so if we draw on that, we know that there's a lot of uncertainty right now, and we have to, my number one piece of advice is that we need to prepare ourselves that this is a marathon, not a sprint. We're going to be in this for a while. So we need to pace ourselves, whether that's on our individual level on how we're working, on our community level on how we're giving, because we can't anticipate 3, 6 months, 9 months down the road where each of us are going to be. And saying that, another point that Sharandeep Singh made was about leadership. And we can see where leadership from our public health and our political leaders really does play an important role here. You see where Manjot was forced to operate on a level where she had to advocate for her patients to get testing done, despite their policy or lack of policy. That was her experience. Whereas some of us had the experience of, we could see we had good public health leadership and seeing other places in the world, and that could help inform our own strategy. So I think that all of us are at different places in this trajectory, and our responses have to be individual to what our local environment is. So as Sikhs, we have an incredible capacity to give. So we have to look at our own local experience to see where the local need is, because it is our responsibility as Sikhs to be on the front lines protecting people. That doesn't necessarily mean on a medical sense. It means it could be in a community, it could be in your family. It could be just making sure you're the person that can disseminate reliable information within your own communities, that you're already doing a service by doing that. For our family members that are concerned about us, we'll be okay. We know the risks. We know from personal protective equipment, having a khulidari is not going to be helpful to protecting yourself against pathogens, but you got to do it. And maybe Sharandeep Singh, working in intensive care, he can speak on that if necessary. But from a personal protective equipment point of view, if you have access to equipment, you should make sure that frontline workers are having the access to medical grade equipment. We know, that there's been confusing literature coming out, confusing discussions happening, and there's a lot. It's hard to trust information when there's so much pivoting, but that's the nature of this disease, that we're learning on the fly. And so recommendations are coming out based on the most evidence that's available to us. And it takes time to build robust evidence. We're fighting time of where we want to build that evidence while we're watching people die. And so, there is, and that's where I think a lot of our these discussions online and the forwards on WhatsApp come from, is because people are trying to get ahead of it, but we can't sacrifice our critical thinking for a quick result. There's no quick fix to this. So trust your professionals and, try to have your Sikhi inspire you, to come together as a community to respond.
I'll say this. If anyone has a very clear fact versus myth, like Birinder has brought up, just put it in the Q&A and we will answer it right away. If there's something you heard about, ਜਿਹੜਾ ਤੁਹਾਨੂੰ ਲੱਗਦਾ ਸ਼ਾਇਦ suspicious ਹੋਵੇ ਜਾਂ ਸ਼ਾਇਦ ਤੁਹਾਨੂੰ ਲੱਗਦਾ ਵਧੀਆ and maybe you want to disseminate it and would like our opinions, we would love to hear your questions and thoughts. I know that there are some things about, just natural remedies. ਜਿਹੜੀਆਂ ਵੈਸੇ ਵੀ ਚੰਗੀਆਂ ਨੇ ਭਾਵੇਂ, obviously nothing in excess is healthy, but there is no harm in adrak or haldi or garam pani or nimbu in life. ਉਹ ਤਾਂ ਵੈਸੇ ਵੀ ਕਰਨਾ ਚਾਹੀਦਾ, ਵੈਸੇ ਵੀ ਠੰਡਾ ਪਾਣੀ ਨਹੀਂ ਜ਼ਿਆਦਾ ਪੀਣਾ ਚਾਹੀਦਾ, acid buildup ਹੋ ਜਾਂਦੀ ਆ. We know these things. And to do it when you're sick is even better because that's when your body is even more fragile to maintain healthy practices, right? Udo taja khao, je soup banana cancho na kaddo, taja banao. Whatever those ideas and remedies are, when they are going back to natural, being more natural, that's fine. I don't know about it being a cure, but we can at least still encourage people to do these things, but perhaps with a different message so that they don't get confused and think, "Ede naal main theek ho jungi bas," or "main theek ho junga bas." I remember I did get multiple messages. I know the message on chloroquine came out. I wasn't even reading the news. I was living the news, and the numbers, our tests were taking 5 days to come back, 3 days to come back. So jo khabran vich aa raha si, that was meri asliyat, meri hakikat from a week ago, right? So main tab padh bhi nahi rahi si. One day I got a call from my relative ke chloroquine le, and I was like, what? I knew the dawai because it's an malaria di medicine naam, to mainu yaad si, mainu like bade like gande supne aunde si, main kade nahi lendi si jadon India jana hunda si. I never liked anti-malarials. But now that I had gone to medical school and studied the drug, I knew there was other stuff I didn't like about it. So I mentioned my concern. I was like, listen, I don't need oxygen right now. I think I'm good. I know we're doing this as a research drug, like a trial drug on our patients who are critical, but I don't feel I should experiment. And my relative was like, no, you have to take it. They were so worried about me. They said it because they didn't want to lose me. I could tell. They were ready to drive overnight with my dad and come get me. Obviously, I had to say no, stay away. But when it came to the medication, my heart broke a little bit because they were pushing for me to take it. And another one called and said they could even get it to me because someone else takes it for another reason. And for lupus, and I felt their love. I know it was all out of love, but the medicine had a cardiac side effect that concerned me a lot. And drugs are not benign. Pharmaceutical drugs are legal drugs. The key word is drug. एक किस्म दा सरीरक नशा आ ਜਾਂ ਸਰੀਰਕ ਦਵਾ ਆ, ਪਰ ਇਹਦੇ ਸਾਈਡ ਇਫੈਕਟ ਵੀ ਜਿਹੜੇ ਨੇ ਜਿਵੇਂ ਕੋਈ ਵੀ ਡਰਗ ਦੇ ਹੁੰਦੇ ਨੇ, ਸਗੋਂ ਉਹਨਾਂ ਤੋਂ ਵੀ ਆਮ ਡਰੱਗਸ ਤੋਂ ਵੀ ਇਲੀਗਲ ਡਰੱਗਸ ਤੋਂ ਵੀ ਜ਼ਿਆਦਾ ਖਤਰਨਾਕ ਹੋ ਸਕਦੇ ਨੇ. So it's just that ਕਿਉਂਕਿ ਇਹਨਾਂ ਦਾ ਭਲਾ ਬਹੁਤ ਆ, there's so much benefit to them that the federal government approves them. In this case, the government hadn't even approved it as a treatment based on research. It was because we were just throwing the whole kitchen sink. Sanu pata nahi si kehdi cheez kam karugi. And here there was some loose information. They said, go ahead, let's just try it. For some reason, my intuition, my 4 years of medical school, my knowledge about side effects wasn't enough to overpower the message my relatives felt because they just were worried and loved me. So all I can say is try to keep your minds open. If you have a loved one in the healthcare field, you want to ask about drugs, if they're hesitant to take one themselves or they have an opinion, it might be just because they had to study for exams for many, many hours and memorize these side effects and all that. They might have some intuition that's a little bit more informed from their studies. And eventually, now, for example, we have research that's showing that these medicines that were initially advocated for are causing those same side effects we were worried about. The heart is getting affected really badly and patients are actually dying more. So, idada jeda, like, koi sawal hove, concern hove, just please remember, drugs are not benign, and anything in excess, even adrak and haldi and garam pani or any pani can be very dangerous. Har cheez apne, like dhyan nal just take it like you would normally,
There was a couple of things I wanted to comment on. One is, I thought that's crossed my mind, and I don't know if we were kind of figured out what's going to happen yet, but obviously we are all in the diaspora communities, but our majority population is within Punjab, and their health systems there are obviously not as developed as ours are in the West. So it's going to be quite interesting to see how the impact of COVID is in those areas, and whether we have the luxury of testing and we have really well developed intensive care facilities and oxygen supplies, etc., and even in our countries we are being stretched. So I'm just curious, if anyone has had any kind of information as to how things are, back in South Asia, or whether there's any institutions or organizations out there that are mobilizing. I know that, often there's quite well developed like disaster relief charities or like Lunger Aid charities. And I wonder whether there's anything that, as a community we need to be thinking about regarding, developing a health infrastructure in places like that.
Definitely. I think that is definitely a conversation that needs to happen. I'm sorry to cut you guys off. This has been such a fruitful and delightful conversation to be a part of, and to be a listener in. As we are nearing the end of this panel, I'd like to direct anyone whose questions were not addressed due to time constraints to either head to our Twitter or Facebook page, and we'll be sure to ask our panelists to put their input to have their input. We are planning on having a follow-up panel in a couple of months, so please do look out for that. Just to wrap things up, on behalf of SikhRI, I'd like to thank Birinder Singh, Manjot Kaur, and Sharandeep Singh for both their service to the communities that they each individually live in, for living out Sikh values, and for making time to connect with the Sikh world on behalf of Sidakers. And thank you also to our e-Sangat. Thank you all for tuning in, for spending some time with us. Please tune in for our next webinar on Mother's Day, May 10th, titled Blessed Mothers, where guests will be speaking about how Sikhi has informed their ideas of motherhood, the challenges, and the triumphs. And I will also just take a brief moment to share some information with you.
Just as you're doing that, there just one just final point that I think that we didn't get a chance to mention. Even though there's there are lots of uncertainties out there right now, what we know has been working. The countries that are getting ahead of it, it's really the basics. Your hand hygiene, your physical distancing. Now, be wary of using the term social distancing because we don't want people to be socially isolated. That's just setting you up for failure. But be physically distanced and socially connected. That is what is working, and be patient. And for if you're looking for resources in Gurmukhi script, I've been working with an organization, the North American Sikh Medical and Dental Association. We have information on anxiety, how to do seva, how to stay connected, facts versus myths. It's both in English and Gurmukhi, and a lot of it is informed from the WHO and CDC and other reputable organizations. So please do check that out.
Definitely. If you could link those resources, any that you have, Birinder Singh, to the chat, the public chat, I think everyone would really benefit from that. I apologize for having to cut this short and so abruptly. I'm just trying to be mindful of everyone's time. I'm just going to quickly wrap up now. And lastly, I'd like to conclude by reminding everyone to tune into the SikhCast, a podcast produced by SikhRI, where we explore the various issues and events affecting Sikhs worldwide. Tomorrow's episode will be hosted by Asha Kaur, where through the Persian influence shabd of Guru Nanak Sahib, she will be exploring our feeling of place in light of COVID-19. Again, I'd like to thank everyone for joining us once again today. Today's webinar will be ending now. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.
Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.
Vaheguru Ji Ki Fateh.